Hi, everybody. This is Dr. Wright, and a frequent question that comes up is where is the best place to have liposuction, outpatient or inpatient? So I'm going to dive into this. It comes up quite frequently. So liposuction, outpatient or inpatient? First, what is liposuction? Liposuction is a procedure that suctions adipose tissue from a particular part of the body for cosmetic improvement. Now, this is the most frequently performed cosmetic surgery, and there are derivatives of liposuction, including lipodema reduction surgery, which uses the cannulas like liposuction, but is goal is for functional improvement and not cosmetic improvement. So it can be performed in an outpatient or a hospital, and 99% of liposuctions are performed in outpatient facilities. Why is that? Well, let's talk about outpatient facilities. They're often usually performed with local anesthesia or tumescent. Patients return home the day of surgery, usually less expensive, usually focused on smaller surgeries, usually liposuction of 2 or 3 surgical areas, and best for patients who are generally healthy. Inpatient hospitals is usually these surgeries are performed under general anesthesias. Patients stay overnight in the hospital. It's more expensive, usually used for complicated or surgeries or when multiple procedures are done, best for patients who have complicated medical histories. So is one option safer? Well, let's talk about that. What makes a surgery facility safe? Procedures that in place to minimize the risk of infection or other complications, specifically trained staff with experience, and adequate time for the tumescent anesthesia to work. Those all help a safe and comfortable surgery. The benefits of a hospital setting. For patients with significant health problems or health risks, hospital setting is often preferred. For higher risk surgeries, when liposuction is added to other significant cosmetic or reconstructive surgeries, hospital settings are preferred. And some surgeons may be employed by hospital or required to perform liposuction in the hospital, or simply don't have their own outpatient facilities they can use. Downsides of hospitals. Hospitals can expose patients to unnecessary germs and pathogenic bacteria. Resistant pathogens develop and spread in hospitals. Surgical teams may not be properly trained or have experience with liposuction. Operating rooms typically have very tight schedules and may not have adequate time to let tumescent anesthesia work. Now, these infections are rare, but that they're always one possible complication. Benefits of outpatient can be done in facilities that specialize in liposuction and similar procedures. The specialization allows for safety protocols and efficiencies that can help the process be safe, comfortable, and patient-centered. And they can have a dedicated surgical team that has a great deal of experience with just the liposuction or 1 or 2 other surgeries. The downsides of outpatient, not ideal for patients with complicated medical problems that are going to require hospital monitoring, and not ideal for patients who need overnight hospital stays. So where's the best place to have liposuction? It often depends on the surgeon's preference and the patient's health. Some patients with complicated medical problems or patients having liposuction combined with more complex surgeries may need a hospital setting. However, liposuction is very safe surgery in outpatient facilities for most patients. Thank you for your attention. Please, if you have any questions or comments, leave them in the comment section. And I'll do more.